Welcome to week 39, mamas. I know you guys are so ready to deliver this baby, to finally hold this newborn in your arms, and I am beyond excited for you. In this video, we're going to talk about how your baby is doing, what you can expect at your next appointment, including what it really means when they check your cervix, and so much more. But first, if you're new here, you're watching in the Health and Medical Zone. And if you're new here, being in the Health and Medical Zone means being in good health and spirit. So if you like being healthy and happy, go ahead and click subscribe, because you are absolutely in the right place. So, 39 weeks pregnant, this baby could come any day now. Your baby weighs around 7 to 8 pounds, give or take, and is about 19 to 21 inches long at this point. All of their organs are fully functioning, and there's no difference in complication rates if your baby were born today versus being born a week from now. The big question now is, when is it actually going to happen? You are just 1 week away from your due date, but remember, your due date is only an estimated delivery date. Only about 5% of women actually deliver on their exact due date, so your baby could come today, or they could decide to hang out for a few more weeks. Now, I know you're probably very uncomfortable right now. You're aching, you're not sleeping well, and you might be having sharp pains in your groin, what we lovingly call lightning crotch. You could be dealing with back pain, and at this point, you might be thinking, the sooner and the better. Or, you might be feeling patient and want to let your baby cook for as long as they need. A lot of this stage is about patience, but let's talk about what some of your options are right now. One option is talking to your OB about an elective induction. Most hospitals and OBs won't allow elective inductions until 39 weeks, so you are officially good to go. That said, it's important to know that labor can sometimes be a little harder with an induction, and there may be a higher chance of needing a C-section. So if this is something you're considering, make sure you talk with your OB or midwife to see if you're a good candidate for an induction. A lot of that decision depends on your baby, your cervix, and your body. Now, if you're planning on having a C-section, it's usually scheduled around 39 weeks. It's generally safer to have a planned C-section rather than waiting for labor to start on its own, and scheduling it can help reduce some of the risks associated with the procedure. At your next appointment, your OB will likely do what's called a cervical check. If you haven't had one yet, let's talk about what that actually is and what they're looking for. Not only will your OB probably check your cervix at your appointment, but when you go into labor, your nurse or OB will also check your cervix at the hospital. And when they do, I want you to understand exactly what they're doing and what it means. During a cervical check, your OB will put on a glove and insert their fingers into your vagina to feel your cervix. Are you kidding me? They're checking for 3 main things: dilation, effacement, and station. Now, the cervix is the bottom part of your uterus, and you can think of it like a thick donut. Most of the time, it's closed. But as labor gets closer, it starts to open or dilate. And yes, they use their fingers to measure how dilated your cervix is. I still can't believe this. Dilation is measured in centimeters. You can be 1, 2, or even 3 centimeters dilated and not be in labor yet. But once you go into active labor, the cervix continues to dilate, and the goal is to reach full dilation 10 centimeters so you can push your baby out. The next thing they look at is effacement. When you're not pregnant, your cervix is pretty thick, about 4 to 4.5 centimeters. As you get closer to labor, and even a little before labor starts, the cervix begins to thin out more and more. Effacement is talked about in percentages. A cervix that is completely thinned out is 100% effaced. A cervix that hasn't thinned at all and is still its full length is 0% effaced. So if your cervix is about halfway thinned, maybe around 2 centimeters thick instead of the usual 4, then they'll say you're about 50% effaced. As your cervix dilates, it also continues to efface. And when you reach 10 centimeters and 100% effacement, your baby is ready to be born. The third thing they measure is called station. Station refers to how far down your baby has moved into your pelvis. While checking your cervix, they also feel for a landmark inside your pelvis called the ischial spines, also known as your sit bones. This helps them figure out how far the baby has descended. If your baby's head is right at the level of the spines, that's called zero station. Each centimeter lower toward the outside is a plus number, so 1 centimeter down is +1, 2 centimeters is +2, and so on. +4 is basically out your baby has been delivered. You can also have negative numbers. If your baby's head is 1 centimeter above the spines, that's -1, then -2, and -3 as the baby sits higher. So if you're 6 centimeters dilated, 80% effaced, and your baby is 1 centimeter below the spines, your nurse will say that you're 6, 80, and +1. That's what those numbers mean when you hear them after a cervical check. Just know that cervical checks can be a little uncomfortable. When they tell you they're going to check your cervix, take a few deep breaths and try to relax. Tightening up, which is totally our natural instinct, can make it more uncomfortable. So breathe and relax as much as you can. And just a couple of reminders. At this point, make sure your hospital bags are packed and ready to go. Check your rings. If your rings are feeling even a little tight, I recommend taking them off now and leaving them off until after your baby is born. Swelling in your hands can happen, especially if you end up needing a lot of fluids, and that can make rings become very tight. We definitely don't want you needing to have a ring cut off at the hospital because it's affecting your circulation. Be sure to rest as much as you can right now. And if you have other children, make sure you've made arrangements for someone to be ready to come over when it's time for you to go to the hospital. If possible, also plan to have someone help you out once you're home and recovering. At this point, you want to be watching for the soft signs of labor. I've gone into much more detail about these in my pregnancy week 36, 37, and 38 videos, so be sure to check those out. But just to recap, soft signs of labor include losing your cervical mucus plug, seeing bloody show, your baby dropping, also called lightning, where the baby moves lower into the pelvis, or noticing an increase in Braxton Hicks contractions. If you notice any of these signs, it doesn't mean you need to rush to the hospital. It just means that labor may be right around the corner. One important thing to remember is that if your water breaks, even if you're not having contractions yet, that means it's time to go to the hospital. And if you start feeling contractions but aren't sure whether they're Braxton Hicks or real labor, start paying close attention and timing them. True labor contractions will become stronger and more frequent over time. If you find that you can't continue what you're doing during a contraction, if you have to stop and really breathe through it, that's another sign that things may be progressing and that you could be in active labor. And if you're ever unsure whether you're in labor or not, call your OB. That's exactly what they're there for. They're happy to check you if needed or help guide you on whether it's time to head to the hospital. I am so excited for you. Many of you have been updating me throughout your pregnancies, watching this week-by-week series, and I've truly loved reading about your experiences. By now, your baby's lanugo, that fine hair that developed early in the second trimester to help keep them warm, has mostly fallen off. Some babies may still have a little on their shoulders, back, arms, or even their cheeks. Thank you so much for watching.